find that the mind can be a very powerful tool. For kids, their imaginations can run wild and it can last for hours and hours just by one little thought. And for us adults, we've created many new inventions and many books and many things just with one little thought. When it comes to a person's mindset, it can be the difference between life or death, it could be the difference between happiness or sadness. And then when it comes to our patients as well, especially in the medical field, the mindset is one of the most important things that we actually have to deal with. Yet it is always constantly overlooked because we are so focused on the actual disease and the patient that we actually don't realize the type of mindset they are. For patients, their mindset is, in my opinion, one of the most important things to actually think about. Because if a patient is not willing to accept their diagnosis or their disease, or even treatment, then we can't help them at all. For example, I've had a patient who just recently was diagnosed with diabetes. And because they were scared of needles, and they was also scared of just not being able to eat properly, they were so worried that they wouldn't be able to live a normal life. If we don't actually take care of this patient's mindset and make them understand that everything's going to be okay, then we can't even start treatment. How can you expect for a person to take insulin or take needles when they're scared of needles? This is one of the reasons why a patient's mindset is so important to us, because it ultimately can lead to them getting better, and it could be the difference between life and death. As a CMA myself, I have seen many patients who've come in who's been diagnosed with new diseases, including thyroid cancer, diabetes, and it is a huge life-changing disease for them. And as somebody that's on the front line who spends a lot of their time with their patients, it's very important for us nurses to make sure that they have a good mindset and they're in a good mood, especially when they're first time seeing a doctor. Imagine going into the doctor for the first time and your nurse is just completely angry and they're not cooperative with you. It doesn't put you in exactly a good mood. It doesn't make you want to actually, be cooperative with the doctor. Instead, by smiling and making our patients laugh, you put them in a good mood and make them want to actually be more cooperative with their disease and with what our plan is going to go to. This is one of the reasons why just psychology and the mindset is so important in the medical field, especially for us. And this brighter attitude usually leads to them to eventually getting better faster. Patients are more willing to try new medications. They're more willing to understand that despite everything going on in their life and everything being bad, it's okay. If we start ridiculing them and start berating them for what they did a couple of months ago, patients lose life, they lose loved ones, they go through rough times, they lose their jobs, and we have to be there for them to make them understand that it's going to be okay. And this mindset is what's very important to the patients, which can ultimately lead to them getting better. And being that their mindset is a lot better, then usually health ends up being a lot better. Somebody who maybe had a high blood sugar and high blood pressure, after a couple of months of actual treatment and being willing to work with a doctor, their blood pressure can ultimately go down, meaning that their, in general, other health problems go better. Their heart gets better, they lose weight, they're more active because they're more willing to actually do things. This is one of the reasons why I think that psychology is very important when it comes to the mind, when it comes to the medical field. And in my opinion, it's actually one of the most important, if not the most important thing, because you cannot help a patient who's not willing to help themselves, and you can't expect for a patient to keep up with their regimen if they feel like it's pointless, if they feel like their doctor is not going to help them, or if they don't do it, they're just going to get in trouble. Thank you.